Hello, everyone. Thank you for joining us today. My name is Mariam. I'm from the University of Ottawa. I'm a researcher, and I'm here with my colleague, who's also a researcher, Rachel. She is working on or conducting a participatory research in Ghana with women and girls who are young and suffering from HIV. Rachel, can you please tell us about the work that you conducted and who you collaborated with?
Thank you, Mariam. So my work looked at the sexual reproductive health experiences of young women and girls who are living with HIV. So I did this work in the Lower Manyakrobo municipality of Ghana, which is one of the municipalities in the eastern region of Ghana. And so what I sought to do was to work with 21 young women and girls within the ages of 15 to 24 to tell us about what their sexual reproductive health experiences have been like. And so instead of using traditional interviews to do that, we used pictures so they could tell us what those pictures look like, what their life looks like, access to reproductive health information, access to anything else, aspirations, and all that.
Thank you, Rachel. So you used a methodology called photovoice, which basically centers the lived realities and experiences of participants in them sharing stories that represent these lived experiences. So my question to you, Rachel, is tell us more about why did you choose this method and why did you think this is the appropriate method to use in this population?
Yeah, so photo voice is a storytelling methodology, and so photo voice centers the lived experiences of people. So you know HIV is a very difficult topic to talk about, and then there's also a lot of stigma in the community where this work was done. So this method gives the young girls the opportunity to share their lives, share their experiences in a way that is creative and also judgment-free. It also allows for community members to come together and talk about what are some of the solutions that they can provide to the challenges that the girls would share.
Very powerful. Thank you, Rachel. Let's look at some of these photos. So I look at these photos without context. I would assume that they probably reflect stigma, lack of access, troubling accessing services and communication, and maybe isolation. So Rachel, did I get it right?
Yeah, Mariam, you're close to what the photographs interpret, and we will see that in a bit. But before that, we will see that one of the pictures is a picture of a hand, and it has a white cloth, and then the second one is a picture of a tree stump with weeds growing around it, and all of these are symbolic. So because of stigma, we cannot show pictures of the girls, so we use symbols to try to interpret what they mean. So in the next slide, we would see what these pictures mean because they would have quotations with the meanings for them.
Thank you. Can you please, now we see that the quotation slide, can you guide us or tell us what we're looking at, please?
Yeah, and so what we are looking at for the picture of the white cloth with the hand, a white cloth in traditional Ghanaian society means victory. So for this participant, this white cloth symbolizes victory against self-stigma. So she's had a lot of education and she understands that if she takes her medication, she is going to be okay, so she doesn't self-stigmatize herself. Also, because of the education that she's had, she understands that her viral load is, the more it's like a telephone number, then there's a problem, right? So the next picture also symbolizes the dry stump with the tree. You can see the quote in there. And it really talks about a girl who is a mother. She's a young mother. She found out that she has HIV when she went to the antiretroviral antenatal clinic. And it was there that she discovered her status. And so she had to drop out of school. So the stunted growth the tree symbolizes the stunted growth of her life. And so even though there are weeds growing, it is not the kind of life that she wanted, but she's growing it in a different way. And we can see from the quotes what this means to them.
Very powerful and impactful work, Rachel. I want to take you back to the picture where you mentioned with the white cloth picture. You said the girls referred to viral load as phone digits, and you mentioned also that because of her education. Can you please tell us more why phone digit and why, can you please elaborate more why they use this to refer to the viral load?
Yeah, and so there's the highest level of the girls that I work with is high school, and in the context, the health workers, some of them do not speak the local language. So if you're explaining HIV concepts to somebody about their health and you're trying to explain, you have to break it down in a way that they are able to understand. And so the telephone number in Ghana is like 10 digits. So if your viral load is high, when we check your blood, we will see that the amount of the virus in your blood is a lot. So it means that you're probably not adhering. But if it's lower than the 10-digit telephone number, then you're doing well and adhering. So this euphemism or this symbol is a way to get them to understand concepts that might be difficult for health workers to explain.
It's amazing, Rachel, to see how community health workers have adapted their tools and method to communicate with these young girls. Rachel, I know you mentioned in the beginning that you have a part where you interacted with community leaders and key informants. Tell us more about that, please.
Yeah, so after this work, we had an exhibition, and so if you can show us the picture of the exhibition, you would see that we had one exhibition with community leaders, and then the first exhibition was with the girls, and so we cannot show a picture of that because of privacy, but the second one was with community leaders. And during this time, they got to see the life of the girls through these pictures, and then they got to see how their experiences are, what are the challenges that they are facing, and then we had some discussions around what solutions they could propose for what they are seeing.
Wonderful. What are the commitments or solutions that came out of these workshop or exhibitions?
Yeah, so there were obviously large social determinants of health that they have to respond to, but we also talked about some of the local solutions that they can provide. And so one of them was to beef up training for health workers, because we realized that a lot of the stigmatization that the girls face comes first from the hospitals. So during this discussion, we had traditional leaders, we had youth leaders, we had community members, health providers, and so they were able to see where they could step in, and so they proposed solutions like trauma-informed counseling, trauma support, also mental health support for the girls, as well as, community dissemination on stigma around HIV. So these are things that they proposed. Yeah.
Thank you, Rachel, so much for sharing this wonderful, powerful, and inspiring work. Before we close this session, I wanted to ask if there's a way for people to interact with your work and stay posted about your updates.
Yeah, so you can follow me on, if you can see the QR code, you can follow me on LinkedIn, where I will be sharing a lot of this work. Yeah, so if you're seeing the QR code, you can follow me on LinkedIn, where I will be sharing a lot of this work. And then there are reports that are going to come out of this, so I will be posting links on there as well.
Thank you very much.